Good evening, I'm Barbara Pinto.
And I'm Chris Bury. Tonight we take a closer look at the crisis facing trauma care in Chicago. The patients who need it most, including young victims of violence, have to travel the longest distances. And when it comes to getting trauma patients the care they need, every second counts.
But there are no adult trauma centers on the city's south side, places where gun violence and shooting deaths are most common. Tonight, we take you to Roseland. There is no such thing as a slow day here at Roseland Community Hospital on Chicago's far south side. This emergency room treats 28,000 people a year.
We see a lot of patients, asthma, seizures, hypertension patients, and diabetes, which runs rampant in this community.
So does poverty and gang violence. Dr. Larry Mitchell runs Roseland's emergency department, where treating gunshot victims has become routine.
So on any given night, we may see 1 or 2, at least, or 3 gunshot wounds. Most of the time, there are non-life-threatening gunshot wounds, but occasionally we get some who are really, really shot up, and we need to try to stabilize them as much as we possibly can, then transfer to one of the trauma centers.
35 Roseland patients were rushed by ambulance to trauma centers last year, 29 already this year. But the closest Advocate Christ Medical Center in Oak Lawn is nearly 10 miles away. Time and distance that can mean life or death.
Patients are bleeding out. You got to move as fast as you possibly can, which is why it's an emergency situation in itself.
There are 11 Level 1 adult trauma centers in the Chicago area, most on the north side and in the suburbs. The University of Chicago Medical Center in Hyde Park closed its adult trauma center decades ago, and Michael Reese Hospital on the south side shut down in 2009. Roseland sits at the epicenter of a so-called healthcare desert, ironically where trauma care is needed most.
It says the community with the crime and the trauma don't have trauma centers, and the communities that don't have trauma centers.
Diane Powell is president and CEO of Roseland Community Hospital, where 40% of emergency room patients are uninsured, unable to pay for their care. As a result, Roseland is millions of dollars in debt, in danger of having to cut services to a population in dire need. And Roseland's problems echo those of hospitals nationwide. According to the American Hospital Association, emergency room visits soared by nearly 44% over the past 2 decades, while 11% of emergency rooms shut their doors. Over a similar period, 339 trauma centers closed. Their high-tech diagnostic equipment and surgeons on call round the clock are expensive, and many hospitals opted out.
Roseland serves a particular population that most cities and most for-profit hospitals do not want to serve.
It is very prestigious to have a hospital in your community. Did you know that?
Roseland administrators, community and church leaders are pleading with Governor Quinn for $7 million to keep Roseland Community Hospital running.
We have reached out to our legislators to say, we need you to partner with us. We need your help.
Powell spoke at a church rally last week, the seats filled with former patients. 9th Ward Alderman Anthony Beal summed up the Roseland community's fight and frustration.
We're going to make sure we continue to fight to make sure that we have a trauma center on the south side.
Back at Roseland's emergency room, further proof of this community's need, as doctors brace for the bad side of good spring weather.
Summertime, when it gets warm, we know at that moment in time there's potential of a gunshot victim being brought in to this emergency room.